Hello and welcome. You are watching Step Up Medicine's video on alveolar ventilation and dead space. Not all the air you inhale reaches the alveoli. Some of it just fills the tubes and never participates in gas exchange. In this episode you'll learn the difference between minute ventilation and alveolar ventilation, what dead space is and why it matters, how to calculate effective ventilation, and how dead space changes in disease. Let's start with definitions. Minute ventilation is the total air you move in and out per minute. It's calculated as tidal volume times respiratory rate. For example, 500 milliliters per breath times 12 breaths per minute equals 6 liters per minute. But not all of that air reaches the alveoli. Some fills the conducting airways, like the trachea and bronchi. This is called anatomical dead space, about 150 milliliters in adults. Alveolar ventilation is what actually reaches the alveoli for gas exchange. It's calculated as tidal volume minus dead space times respiratory rate. This gives a more accurate measure of how much fresh air gets to the alveoli. There are two main types of dead space. Anatomical dead space is the air in the conducting zone, from the nose and mouth to the terminal bronchioles. It's normal and present in everyone. When a nose and noel. Physiological dead space includes anatomical dead space. Full are any alveoli that are ventilated but not perfused. This happens in lung diseases like pulmonary embolism, where blood flow to some alveoli is blocked. In healthy people, physiological dead space is nearly equal to anatomical. In disease, it increases and reduces gas exchange efficiency. Let's go a step deeper with a key formula. The alveolar ventilation equation links ventilation with CO removal. Here's the concept. PaCO is inversely proportional to alveolar ventilation. That means, if alveolar ventilation goes down, arterial CO levels go up. This is important in assessing patients. For example, if someone is hypoventilating, their CO builds up, leading to respiratory acidosis. So if a patient's PaCO is high, it usually means their alveolar ventilation is too low. This equation is the physiological basis for blood gas interpretation in respiratory failure. Let's review. Sub-ME. Minute ventilation equals total air moved per minute. Nite shiri karmentamichin. Alveolar ventilation equals the portion that reaches the alveoli. 2. Dead space includes air that doesn't participate in gas exchange. Physiological dead space increases in disease, like pulmonary embolism. Efficient gas exchange depends more on alveolar ventilation than total ventilation. Here is a quick question to test your knowledge. Which calculation gives alveolar ventilation? A tidal volume times respiratory rate. B. Vital capacity divided by minute ventilation. C. Tidal volume minus dead space times respiratory rate. D. Residual volume times respiratory rate. Drop your answers in the comments. If this helped clarify your basics, like and subscribe for more high-yield videos. Up next, gas exchange and diffusion. Thanks for watching, and keep stepping up your knowledge.